State's Attorney, Aisha Braveboy. We look forward to talking about all things mental health and public safety. Introducing our Chief of Staff, Judith Danzo.
Good evening, good evening, good evening, good evening all. And again, welcome to our May Community in the Courthouse. And shout out to the phenomenal woman behind the voice of God, our very own Sade Dennis here in the office. But yes, we are very, very excited about closing out this month in such a powerful way with this dynamic and very much needed discussion and conversation amongst our community. And especially during this time. The reality is that, we can never have this particular discussion enough. The issue of mental health is a constant that will not cease to exist in our everyday lives. And many of us have either personally experienced it or directly or indirectly, and or certainly know someone who has had challenges in dealing with a mental health issue on at least one occasion. And so we're really happy to focus in on this issue this evening. And so when it comes to really talking through the issue at hand and how we address it, how we cope, how we access services, how we educate our community and quite frankly, one another, how we really take this oversized complexity and peel back the several layers to really getting to the root of this issue. We believe and know that this is absolutely one of the ways in which we do it through forums like this. From a public safety perspective, we all know that unfortunately we're living through terrible times and times where mental health is on full display. It really does require us to truly utilize our discretion as a powerful entity in the criminal justice arena to make sound decisions and strides in how we best address this issue, particularly when it comes to the intersection of mental health and public safety. And so that's what we are looking forward to being able to do this evening. I can tell you that, there has been a charge from above. Madam State's Attorney Braveboy, under her administration since day one, really throughout now, it continues to be a charge that under her leadership, we remained and have remained conscious of how we view mental health in every single case where there is some indication of mental health being at issue, and certainly looking more closely at how we handle and dispose of these cases because we have to. We work very extensively day in and day out with our public safety partners, certainly our partners in the community and our courts, to really determine and understand how we reach best solutions for those that are impacted by mental health when it comes to our cases. And we certainly do take pride in our ability to use that appropriate discretion in addressing mental health and disposing of those cases the best way we see fit. And I know that Madam State's Attorney will certainly speak to some of the specifics in terms of how we do so under her leadership, and we look forward to hearing from her very shortly. I'll pretty much stop there as an intro. I do want to turn it over to our phenomenal friend to the office, Prince George's County Bureau Chief, Madam, I like to call her Madam because she's a madam herself, Tracy Wilkins from NBC4, who will be our amazing moderator for this evening. And so I will allow her to take it away at this time. Tracy, thank you so much for participating and serving as our moderator for this evening's Community in the Courthouse. Thank you.
Of course, Judy, it's always a pleasure to see you, and thank you for having me to talk about this very important topic. So hello, everyone. Thank you all for joining us this evening. We have experts in Prince George's County who are going to be able to break down for us how mental health issues are addressed by the Prince George's County court system and what resources are there to help folks. It is very important to the entire Prince George's County government to make sure that there are ways to deal with folks who need help before they touch the justice system. But then if they find themselves in it, that they have the resources that they need to find their way out of it in a way that makes sense. And at the same time, being held accountable when necessary as well. And the woman who has to balance all of this work and does it with a very big heart and is wholly dedicated not only to solving crime in Prince George's County, but preventing it whenever possible. It's Prince George's County State's Attorney Aisha Braveboy. And Ms. Braveboy, it's always good to see you. And I am going to turn my camera off for a moment to give you a second to address the folks.
Thank you so much. Thank you also to Madam Chief of Staff, GM, for your words and your introduction. I'm super excited this evening to have all of you residents and also our partners here in Prince George's County for this very important discussion. You know, we are working really hard in our office to keep people safe, but also make important reforms to our justice system. And every year, I go to Annapolis and I become a lobbyist. I lobby on behalf of the people of Prince George's County who want to see smart laws to protect our communities, but also want to ensure that the justice system is fair and is balanced. And so I just want to mention a couple of bills that I worked on this year. One is a bill that bans ghost guns in the state of Maryland. That the ban on the sale of ghost guns goes into effect tomorrow. So tomorrow it is unlawful or illegal to sell, buy, transfer a unserialized ghost gun here in the state of Maryland. If you currently possess and own a ghost gun, you must get that gun serialized by 2023, March of 2023. But again, we are very serious about getting guns off of our streets. And we have far too many of our children and far too many people who have committed violent felonies in the past and those who have mental health issues who are possessing guns in our community. They are a danger to themselves and they are also a danger to our community. And so we're working really hard to ensure that our laws create an atmosphere of seriousness when it comes to weapons, and also that we are administering our justice system in a way that sends a very strong message, but again, that is also fair and just and compassionate when necessary. And that's why I'm really very pleased to have this discussion tonight. We have to talk about mental health. We just have to do it. It is something that impacts our families, it impacts our schools, our workplaces, and our communities. And so we can't run away from it. We can't pretend like it doesn't exist. We can't lock everyone up. We have to deal with it. And that's what tonight is about. How do we deal with individuals in our communities who have mental health issues? How do we prevent them from being in the justice system? But if they come into the justice system, we'll talk about those resources that are available to them, but we'll also talk about what we need moving forward. Because while we have made steps in the right direction, our job isn't over yet. We still have a lot of work to do to address individuals who have mental health issues in our justice system. So we're going to have a very important discussion with some amazing people. It is estimated that 56% of our state prisoners have some form of mental health disorder, and 64% of the people in our jails have some type of behavioral or mental health issue. And in fact, about a third of those individuals are on medication, which means we are administering as a government medication to individuals who are in our justice system, many of whom have committed very serious offenses. And so we have to balance the safety of our community with the needs of individuals in our justice system. And that's what I am committed to do. I'm committed to having these tough discussions, but also to coming up with solutions together so that we can make recommendations to our legislature and our local government on what we can do better as we move forward. So today we have with us Lieutenant Colonel John Clark from the Prince George's County Sheriff's Office. We also have Mary Grace Waldron, who is one of my assistant state's attorneys, and she is assigned to our mental health court. Wendell Williams from the Crisis Prevention Resource, he was a crisis prevention resource specialist in the Prince George's County Department of Social Services. Those will be the individuals who will participate on our first panel along with myself. So I'm very excited about this, and I will turn it over to the Tracy Wilkins to begin the panel discussion. Thank you.
Thank you, Madam State's Attorney. And you actually provided some of the stats that I was going to ask you about. I think that when people hear those numbers for how mental illness is presenting itself within the jail system and within the courts, that there's a better understanding of just how serious this is, because these are the folks who are interacting with them before they end up in these spaces, and then they have to be cared for once they're in the spaces. So I do want to start with Mr. Williams. I just want to ask you about the crisis prevention resource part of all of this within the Prince George's County Police Department. If you could walk us through what happens when you get that call that there is someone who is presenting what may be mental illness, or there's something that's just not right. And let's start with that without the person being armed. Let's just start with someone acting out and a call has gone to 911. What happens next?
Okay. Did you direct that question to me, Tracy?
Yes, Mr. Williams. So crisis prevention.
It's kind of funny that you would direct that to me, because I'm sitting here right now. It's a lot going through my head. I just left a young man on Branch Avenue who's been walking Branch Avenue for over 3 years. I've been working with him for 2 years with him and his family. And he's a 2-time Afghanistan vet. Something happened. And we haven't been able to come up with any way to help him move forward to a better resolution of his life circumstances. So that's what I was thinking about when you called on me. I didn't know you were calling on me first. Mm-hmm. And I spent an inordinate amount of time, of my own time, thinking about what I can do next to help some of these people with very challenging mental health issues find some kind of progress toward a life that you and I would consider to be desirable. And all I can do is keep him in fresh clothes, make sure he has something to eat, and hopeful from one day that a miracle will happen. I've had him in hotels. I've had him in various places that we have as part of our toolkit, and he just walks away. And his mom has told me he's been in every veterans program in the area, and he never stays more than 2 days. This is what I work with every single day for 8 hours.
As someone dedicated to doing this kind of work, what would you say is the biggest roadblock in success?
You know, Tracy, let me preface my comments by saying I'm an employee of Prince George's County. Wink, wink. You know, probably the biggest roadblock is I can bring all the resources to bear that I know about in the county and outside of the county in terms of county structure to help this person, but we'll get down to that point where all these people have interfaced and worked together to come up with a plan for a great outcome for this individual. And it all comes down to that individual saying, yes, I want this solution. And advocates on the other side of this are saying that the client has the right to refuse or to participate. I get that. As a matter of fact, Governor Gavin Newsom right now in California is catching a lot of heat over the same issue. How do we balance the client's rights? And I heard the state's attorney talk about the rights of safety for the community and other things. But unless we can get that person to say, yes, I want treatment, I want housing, I want to get off the street, it'll just get to this point where we can't do anything. Can't make them get better. We can't make them accept the help. And what people don't understand is the way things are set up. We're asking people who have extreme difficulty in making some clear decisions to make a decision.
And they have to do it with limited time. They have to make it quickly because of how these things tend to unfold in some instances.
Absolutely. If I get them to the emergency room, say of Southern Maryland Hospital, and they get triaged, it doesn't matter what they said to me or the officers on the scene. They again have to say yes to the attending or the intern, whoever's in the emergency room triaging them. And at that point, I've had so many instances where by the time I could get back to my area, the person's already been released by the hospital as saying the person won't self-defer. And I think I see Sheriff Carr shaking his head, and that's our biggest.
Yeah, and I'd like to bring Sheriff Carr into this at this point in the conversation. You know, what is the frustration for law enforcement? Can you begin to describe what it's like on those moments when you are arriving to a scene and dealing with someone who is not capable of making good decisions for themselves, but you need them to participate in their own welfare? Lieutenant Carr, what would you say?
So thank you for having me. And I'm very glad that we're able to discuss this serious issue here today. And hopefully we continue this conversation. But from the law enforcement perspective, what we see is that you're asking deputy sheriffs, you're asking for officers to, one, respond to a scene in which we may get that this individual may be violent, may be acting out. So once we get to the scene, you're trying to assess exactly why this individual is acting out and what is going on. The officers and deputies are required now to go through crisis intervention training, in which we teach in the academy. But the Prince George's County Sheriff's Office, we also teach an additional 40 hours as well. But you're asking to make an assessment and try to address somebody who is in distress. And this is, through no fault of their own. This is something that we would consider more of a health crisis. And you want to make sure that you treat this as such. You don't want to treat this as a criminal act or that this person is defying you as a law enforcement officer or a deputy sheriff. You want to treat this as a mental crisis, and you want to address it as such. So you want to be able to figure out exactly and try to develop some sort of communication, but you also want to talk to family members. You also want to see and get as much information as possible while making sure that this individual is safe, and then also try to make sure that you are safe as well. So from the law enforcement perspective, we've been seeing a huge increase in our numbers when it comes to mental health and addressing that. Now you need to make sure that even when somebody does commit an act or a crime, that you have to worry and see, hey, was this because of his mental state? Is this because he is going through a situation where he's having an episode? And if such, you then need to address that first. So there have been times where an individual would have a criminal warrant and we may come into contact with this individual, but if he is a threat to himself or herself or others, we would then take that as a mental health crisis and we would get them the attention that they need before we address any of the criminal acts or any as far as a warrant. Before we address that, we will address it from a civil standpoint and provide them with the mental resources or mental health resources that they deserve.
Lieutenant Carr, let me ask you a question, because I hear you mentioning the hours and the amount of training that goes into dealing with people with mental health issues and learning how to address these situations, and talking about 40 hours worth of additional training that is provided. When I hear the stats for the overwhelming number of people who are ending up in these positions, I mean, do you feel like that training should be a larger part of what you all are trained to do now? Or what are your thoughts on that, Lieutenant?
So I would agree that we always can, train and try to understand and address. But one thing when it comes to public safety, we have to be honest with ourselves that this is outside of our scope. And you have nonprofit partners, you have government partners that we need to now bring in to assist and help us, because this is out of our scope. People may call 911 and you may say, hey, this is a uniformed officer. They're able to assist and actually provide some sort of assistance. There are some things that we're not equipped to really handle. And we're not clinical technicians. We're unable to diagnose while on scene. So therefore, we need our partners in the mental health community to be present with us and, to also speak to, the legal system in order to work hand in hand. And that's what this is. It's a partnership. You need to have a partnership in order to address it. And one of the biggest things about a partnership is understanding your role. And coming from a law enforcement perspective, our role is we're not able to address and deal with that. And we have to be honest in reference to that. We cannot handle this. We should not, arrest anybody and think that we can arrest ourselves, out of an issue or problem. As far as somebody acting up, we really do need to rely on our partners, our mental health partners, to address some of these issues. From the sheriff's office perspective, we deal with our emergency petitions in which a loved one has gone to the courts and has asked for relief. In that relief, the judge will actually give them what they call an emergency petition that will instruct us to go to that individual and to basically take this individual from their home or wherever they may be to the hospital so that they can be seen by a clinical technician or a doctor. That's a civil order. And that's how we handle it. We handle it in the approach of this is a civil order and that somebody is in need and that we need to address that need. It's not a criminal matter. It is something to where we actually try to empathize and understand exactly what that individual is going through and provide them additional resources that they need.
Thank
May I
you.
say something?
If I can just for 1 second, Mr. Williams, I'll come back around to you for a moment, but I want to bring Ms. Waldron in at this point to just talk a little bit about, as an assistant state's attorney, when you are dealing with these cases, what is happening when you are looking at someone who has a mental health issue and they are now before the courts and you all are in a position to handle these cases with that being a part of what's contributed to them being there. What normally is the circumstance that brings them before these judges? What is it specifically? Is it one thing or is it multiple things?
I forgot to unmute, of course. In mental health court, we treat the person as a whole and not just as being a defendant. So we offer them case management services. We have 4 case managers who each have about 40 cases, and they direct the person into treatment and then monitor that they participate. The other thing is that we look at the cases to assess whether it's someone who it's a district court case where someone can benefit from case management, that they want the case management. And ultimately, I think we help the community be safer as we offer not only treatment for the individual that's the defendant, but support services for families too. And since just the large portion of our offenses in one way or another revolve around the family or the intimate living situations, I think it helps with the transition.
So would you say when you're saying that they involve the individual and their families, is this about individuals acting out? Is this about the families burned out without resources? What is it that brings these folks to court?
Brings them to court is the commission of the allegation of a criminal behavior. So being charged with a crime. Okay,
let's talk about your resources. What are your resources like in your office?
The resources are, well, that's what the case managers are wonderful at. They locate the service providers in the community, whether it's wraparound services, where it's mobile treatment, which works for so many of our people because they have a difficult time getting to the programs. And there's a certain level of care the folks need. A defendant would need a higher level of care if they are unable to navigate getting to their doctor's appointments and the services actually come to them. So those are the resources that are available. They're a combination of public and private resources.
Would you say that in your office, you all have repeat offenders? I mean, folks who you are used to seeing and you know their cases and you know their families?
Oh, yes. too many of people are known to us. We saw 2 new people today, but they weren't really new. They're people that we'd had in the past. Yes. And families will often reach out and want to know whether someone can be in mental health court. They'll hear about mental health court and they're thinking, that might be good for my family member, or even defendants themselves will reach out and want to be involved in mental health court. That always makes the heart feel very good when someone realizes they have a problem and they need some help managing it.
Madam State's Attorney, I'm going to ask you, what are your thoughts? I mean, when you're hearing terms like repeat offenders, that we know these folks when they're coming into our courts, what is the feeling then? Is it frustration? Is it, this is just the nature of the beast? Or is it, how do we clear these cases out? How do we get other partners involved? What are your thoughts? Oh, and you have to unmute.
So sorry. Thank you. My thoughts are that we need to have a more robust and comprehensive mental health response, not just for criminal justice matters, but also just in general. What we don't have in our communities, in a lot of communities, are long-term treatment facilities for individuals with long-term needs. Oftentimes, especially when the sheriffs encounter individuals, they're taking them for 72-hour holds, or 48-hour holds, or something where it's a short period of time to deal with the acute issue happening at that moment. And then the hope is to get the individual, if they're on medication, back on their medication, or if the individual has not been diagnosed, to get that individual a diagnosis. However, we can't hold people indefinitely. And there's not the space even to hold individuals indefinitely. And so what has not happened is, steps towards building and creating these long-term institutions that are needed to assist people who need more than just 72 hours, because there are people in our communities that need long-term care. Families oftentimes don't have the ability to really handle their relatives. They love them, they care about them, they want to see them do well, but then they're scared for themselves. They're concerned about their own personal safety or the safety of other children. And the hardest part, and I'm sure that all of the panelists can tell you, is when you have a parent who has a child who has a mental health issue, and that parent loves that child, wants to take care of the child, but they have other children in the home too. And they're concerned about the safety of those other children. And so how do you balance that as a parent, right? How do you balance that conflict? And so if you can imagine trying to balance that in the justice system, I think we are not really equipped fully to do that ourselves.
Yeah.
I agree with Colonel Carr. We are not equipped fully to do that. I did not go to school to be a psychologist, psychiatrist. But what I do know is that we have people out in our community that have those skill sets. And what we have to do is we have to invest in them. We have to invest in them, because that's how we really begin to solve the problem. We're only a Band-Aid. Honestly, we're a Band-Aid. We are not really going to fix the problem.
I like what the state's attorney said. What the state's attorney said about the Band-Aid. That's exactly what I feel like we're doing. We're putting Band-Aids on bullet wounds every day when we deploy. We need to be catching this long before they have contact with the criminal justice system. And there's not a week that goes by that I don't get a call from a client, parent, or family member that has had to do the same thing the state's attorney just talked about. They had to get the person out of their house for the safety of the other kids in the family. And a lot of family tension can develop that could lead to where Sheriff Carr and our police officers have to intervene. And it's all because of the frustration on both sides. It's not a week.
I'm sorry to interrupt, but I want to ask you a quick question. If, as someone who is on the ground doing this work, if you could suggest a way to interrupt before this ends up in the court system or a space or a place, where would that interruption need to happen? Would it be in the homeless population? Would it be with some of the folks that Ms. Waldron said are repeat offenders that they need more visit? Where would you say folks who want to get ahead of this need to jump in to get ahead of it?
If I was Bill Gates or Elon Musk, I would use my own money and build a mental health crisis care center where a person could go and stay for 3 weeks to a month, month and a half to stabilize, get assessed, get back on medication, then address the other issues like housing and court cases and those kind of things. That is essential. All the other jurisdictions I worked in, we had them. I worked for Fairfax, I worked for Arlington, I worked in Alexandria. And we had these mental health crisis places where you could go stay for 2 or 3 weeks and get like a tune-up, look under the hood, get you in a better position, but more importantly, get you stable, get you some food, get you rested, because a lot of the clients I see out there that we're talking about, they are just worn to a frazzle. Can you imagine the frustration they feel in trying to communicate and nobody can hear them? That's because most of the world is speaking French to them and they speak Spanish. And then they get frustrated, and then the family members get frustrated, and anything can happen after that that could involve law enforcement.
Let me ask you this, Mr. Williams. We have a mental health crisis center that is being developed at Doctors Hospital right now that the county has put a substantial amount of money into. We have one that just opened up in the southern part of Prince George's County at Southern Hospital. And there is another one that's in the works in the northern part of the county as well. So there's been this emphasis now on trying to deal with this. Largo Hospital, the Capital Regional Hospital, has one as well. When you hear that, what are your thoughts? Do you think great, or do you think I'm worried that when this opens, we don't have enough beds? Or have you even been in to see these facilities to know if they, are going to do the job that's necessary?
Well, as a county employee, I'm tempted to go with the no comment, but I will say you use key words like will be, coming online, thinking about. And so whenever it comes online, we're already going to be behind the curve. Okay, if they build 20 beds, we're already going to be needing 50 or 100 beds because we're always behind the curve on this. This is happening more than the public realizes. And our police officers should not be shouldering this particular burden. No.
So, Mr. Williams, can I jump in? I'm sorry, Tracy. So I know
just quickly, because we're about to wrap up this panel. So tell me in 20 seconds.
No, I was going to say, we call it high utilizers, those individuals that we see. And we had an individual that we encountered 25 times within 3 months. So this is not just a Prince George's County issue. Sheriff's Office is responsible for transporting those individuals to the state facility, and the state facility doesn't have beds. We've been turned away from the state facility, and we've had to bring individuals back. So this is a problem not only just here in the county, but throughout the state. We do not have enough beds. The facilities are unable to actually deal with and address long-term care, and that's our biggest need here right now.
And I did want to say that, kudos to our county executive and county council for investing in these facilities. I think the one thing we want them to be is successful, and we want them to be meaningful for those who really need the services. So I think one of the things that, we certainly can come together to recommend is that, we monitor how well these new facilities, when they come online, are working. Are they really addressing the needs? And I believe that the county will be open to, maybe expanding services or, having maybe a longer term care opportunity for individuals, because oftentimes it is a short-term care facility that is being built, as opposed to the longer term, whether it's 3 weeks, 4 weeks, or even longer. I mean, some people have issues where they are clinically they cannot function in our community successfully, and that has to be addressed. And so there's a lot of needs that we have, and I want to make sure that these facilities are really truly addressing the needs. So I think it's great that they're being built. I am completely supportive of everything that has happened, and I just think we need to have these ongoing conversations when they open to make sure that they're actually addressing the needs that we see on the streets.
Okay, well, I would like to thank everyone who was a part of this first panel. We're going to move on to our second panel. And I just would like to say, as a reporter who consistently does stories on what's happening with the counties addressing mental health issues and needs within our community, whenever I see these spaces, I always wonder, is this enough space for our problem? Are these enough beds, and can people stay here long enough? And I get concerned, but I understand. So thank you, Lieutenant John Carr, for joining us for this conversation. Mary Waldron, thank you. Wenda Williams, and of course, the Honorable Aisha Braveboy for joining us. Thank you very much for all that you had to say here and for all of the information that you've been able to share with us. And I'd like to now welcome in folks for our second panel. We're going to continue this conversation with the second panel. And thank you to everybody who is submitting your questions. And we are going to go through those questions after we're done with the second panel. So if you have anything that you want to put in the Q&A, you want to put in the chat, we will check those out and see if we can get to as many of those as possible. So I understand that I want to start first of all with Alana Gale, who focuses on work directly with the problem-solving courts and regularly deals with issues that are going on within the Prince George's County court system, who is joining this panel. Also, Jade Mathis, founder and mental health advocate with the Resilient Gym. Dr. Amar Mukhtar, who is a psychiatrist and director of behavioral health for Greater Baden Medical Services. Greg Franklin, who is director of the Sante Group. Hello, Greg. Always good to see you. Michelle Hare, who is the owner of DXT Therapeutic Services. Tyrese McAllister, who's the owner and owner of Clinical and Forensic Associates. So thank you. And we also have some additional providers who are standing by. So we're looking forward to this conversation. And thank you everyone for jumping in. So we've already talked with the officers who deal with this, the folks on the ground who are assisting them and partnering with them to take care of this. I want to talk about some of the services that you all offer that tries to work to kind of intercept some of what we're seeing going into our court systems. And I'd like to begin with Greg Franklin and the Sante Group. I'm very familiar with the work that Mr. Franklin does. So Mr. Franklin, can you talk just a little bit about partnering with police departments and the work that you all do specifically, for instance, with the Prince George's County Police Department, to be that extra voice to help them when they're dealing with these calls where they know they're going to interact with someone who has a mental health need?
Sure, and thank you, Tracy. And so one of the things that we do at Affiliated Sante, we have for the last 20 years been running the Prince George's Crisis Response Services. I've been with Sante since last September, and the county is continuing to provide more resources. IMIND has come on over the last year and running an additional team, but we've worked closely with the police departments performing the CIT training that Lieutenant Colonel Carr mentioned a little bit earlier. That is crisis intervention training. And one of the things that's important about this is, as everybody has said already, getting everybody to do the jobs that they are meant to do. Officers are generally not trained for providing mental health care. And one of the things that we do is going to different departments and providing regularly the CIT training, so that way officers have a better idea. But even this 40-hour-a-week training it's not sufficient. It's probably one of the most frequent questions that I get asked when I go to the departments and do different trainings is this enough? Do you think we need more? And honestly, I tell them all every time, this would be a great start for all officers at the start of training, but it should be some kind of annual ongoing training where they continually get to learn, grow, and see these things, but also the importance of having mental health clinicians be involved with the police department. Sante as a whole operates in multiple jurisdictions, and we have various types of response systems, from co-responder models where we do respond with the police in their vehicles, but there's also, as we've had in this county, where if they can call us if they need support, or we will call them sometimes if we're performing an emergency petition. To that end, though, we also work with the police departments to do emergency petition training, because a lot of times officers don't realize what they can do because they are trained as law enforcement officers and not as mental health clinicians. And if I could just touch on something that was brought up in the last panel's discussion about where to start. One of the single biggest challenges to the mental health crisis system right now is that licensed clinicians can honestly make more money working from home in private practice, and the system has not caught up with paying clinicians what they need to make to make a living. So one of the biggest challenges right now for inpatient, outpatient, mobile treatment services is getting these licensed clinicians paid at rates that is actually going to get them doing this work and not just doing private practice therapy. Is one of the hardest places to start. So continue to work with the police departments. We also been working with Captain Bethonical and the Sheriff's Department on these high utilizers, trying to connect the families to supports, because as was mentioned again, these are just Band-Aids, getting them the crisis stabilization services. What needs to happen is long-term ongoing care where we can actually go out to people's homes, meet with them where they're at, bring those the psychiatry, counseling, and all of the services to them when they can't meet it on their own.
Thank you. I have a question for Dr. Mukhtar, and I think that you, and I'm sorry, am I pronouncing your last name correctly?
Yep, you got it, Dr. Mukhtar.
Okay, great. Thank you, Dr. Mukhtar. Just listening to what Mr. Franklin just said, it just seems to me that with the amount of mental health concerns that our police officers are faced with every day, that if the training focused on that in a specific kind of way, as much as it does, for instance, weapons training, that maybe it would change the minds of the officers and perhaps better prepare them for what it is that they're dealing with on our streets. Am I missing the mark, or is that something that you think would be beneficial?
Yeah, I think that would be extremely beneficial. And as you were kind of talking about that, I immediately thought of the Veteran Affairs, which I worked briefly during my training. And their model, physicians, psychiatrists, patients, all types of medical providers and staff were all under one roof. And I think what it did was really allowed a platform for physicians to get to know police officers, the officers got to know the clinicians, the staff. We all ate at the same cafeteria. And what it did was provide a natural forum to build relationships, right? So when we did run into system challenges, I knew a lot of the officers by name. Officers knew me by name, right? So they could ask me, hey, in this situation, what do you think needs to happen? Or I ran into this, do we have any sort of resource or any avenue to get this type of person treatment, right? And so it was on the forefront of their mind. The legal side was on the forefront of our mind. We knew that if we had a difficult patient, we tried to give the officers as much information as they could have prior to going in and doing that well check, because we knew the challenges that they were going to face. If we can kind of develop or replicate this on a macro scale, right, where maybe I don't know every officer's by name, but my department knows their department head and their department knows the school's head, and there's some sort of connection between these organizations, I think that at least we can start the process of, when you think of calling this colleague, what they're going through and what their challenges are. How could I make their life a little bit easier? Right now, and I'm not as familiar with law enforcement training as some of the other panelists here, but I would imagine the amount of training that they get from medical side, be it understanding diagnosis or what symptoms may present themselves in their training for law enforcement, is not going to be as much as a officer that's going to be working at the Veterans Hospital and seeing this every single day, right? So just catching up, and matching up those who are going to be doing these well checks and are going to be helping, first line, matching up their level of comfort, training, expertise, I think is really important.
Dr. Mukhtar, I want to ask you, what do you think about the county's efforts to catch up to its lack of mental health facilities? When you see the efforts, do you think, oh, about time, or do you think, you still have a long way to go. What do you think?
Yeah, the latter, right? And so this is not just specific to this county, but I think nationwide, right? And in all the counties that I worked in previously, some did better than others, and even at the VA, they had their shortcomings as well. And it always boils down to not enough, not enough partial hospitalization options, not enough intensive outpatient providers, not enough crisis teams to be able to answer those calls. When you discharge somebody from the hospital, and I heard the officer talk about the challenges of taking someone to the ED and then, an hour or two later finding out that they got discharged. We're part of that is due to resources, right? You have a certain amount of beds in the hospital, and you've got to kind of weigh, who really needs that bed, and sometimes it's difficult, but you've got to make that call one way or another. So, any step we take right now is just not enough. I think there's a long way to go to fill that gap, but those efforts are not overlooked, and I think they're important first steps to get there.
Thank you. Jade Mathis.
I could add on to that real quick. I'm sorry. I just want to add on to that real quick too, that in need of more resources. Santi's contract with the county is actually ending at the end of June, and there is a new agency taking over with iMind, but again, it speaks to the issue of there's not enough resources providing this care in the first place, as Dr. Mukhtar was mentioning.
Jade Mathis, I'd like to bring you in. Jade is the founder and mental health advocate for the Resilient Gym, but also a former assistant state's attorney with the state's attorney's office. Jade, after working on both sides of this issue, where do you feel like the mark is most being missed?
So I feel like the mark is most being missed, number one, initially in the community work being done with the resources. So even in, Prince George's County has a large population of churches, of affluent schools. Those are some of the places that I think that we aren't talking about mental health in our community. And that's why, number one, it is so stigmatized within our communities because no one's talking about it. Number two, when you are arrested after you've already committed the crime and you are in court and you are in front of me as a prosecutor, a lot of the times, just like State's Attorney Braveboy said, a lot of them already have diagnosis, mental health diagnosis. So now I, who am trained in law, I have to switch on another hat and kind of be a psychologist or a psychiatrist. And I've, on the opposite side of the courtroom at times, looked at someone on the other side and said, this person isn't right. Like, I know you're the defendant and I'm the state, but something isn't right upstairs. And I don't feel right, asking for this amount of jail time. What you need is help. However, when you look at certain states, and maybe more now than when I was a prosecutor, but when I was in the courtroom, there were like two places that we would send referrals to, and oftentimes they had no beds available. So to house the individuals while they were waiting for beds or evaluations, they would be in the Department of Corrections. So you're essentially being punished for something that you need treatment for. And it's a returning cycle. Like we see you'll go for 30 days and you'll go to this place and you'll get an evaluation, and then you'll get on your medicine, and then you'll veer off, and then you'll end up right back in front of us again and again and again. And it's at some point, like, we have to help. Who's going to help you help yourself? Because my job is to serve justice on behalf of the state of Maryland and Prince George's County at the time. However, I'm concerned about you. And as a person in my community, justice doesn't always look like incarceration. Justice is going to look like help and service. And that's why I'm happy State's Attorney Braveboy is putting together panels such as this, because people have to understand there's so many different avenues of where this starts at, where this problem starts at. This stigmatization is the number one issue in the African-American community. That is why I do the work that I do. After being a prosecutor for 7 years and a person who deals with mental health myself, and who was diagnosed over a decade ago with a mental illness, I just said, this is something that I need to tap into full time, because these individuals are suffering. They're suffering behind bars when they should be suffering in treatment facilities, but because of lack of resources, they're not in treatment facilities, they're in a DOC.
Right. And sometimes you have to wonder if lack of resources really means just a lack of feeling like that needs to be where we're putting our energy, right? I want to bring in Alana Gale here, who is still a state's attorney who is doing this work. When you hear what is being described here, Alana, what are your thoughts about what Jade is saying about being in that courtroom and knowing that there's something more that needs to be done?
Thank you. Well, I'm currently assigned to the problem-solving courts in circuit court. And so we have the opportunity to actually do something about that. So when the assistant state's attorney in the courtroom, like Jade, when they figure out that maybe there's something wrong, that person can be referred to one of our problem-solving courts. We have juvenile drug court, adult drug court, veterans court. I heard you, Mr. Williams. We got veterans court. And we also have a reentry program, all of which are primarily dealing with substance abuse, but we know that these people also have mental health issues. So when the ASA in the courtroom figures out that there's something, they can refer it to our courts. Once they refer it to our courts, and I look at that person, we do an evaluation is done by the clinical team. They kind of figure out like, what's the issue here? Are they using marijuana because they have a bipolar issue? Are they using marijuana, especially like for veterans court, because they have a PTSD issue? I mean, kind of what's going on here? We do have resources that we can refer people to. Again, we'd love to have some more. And some of the people whose names I see on here are names that I know and groups that we work with. But we definitely try to do what we can to get people in the right place. Our veterans, we're very proud of our veterans program. We work with the VA. The VA has a very robust program for dealing with mental health issues. Our juvenile drug court, I mean, it's kind of a one-on-one when we're dealing with these young people and helping them to understand how to cope better with themselves, with their family, with their schoolwork. And then reentry court is a little interesting. We are dealing with people who are coming from prison. Many of them have been incarcerated for 20, 30, 40 years. You know they have mental health issues. So we are dealing with them and helping them to come back into back into our community. And we're using many of the people here as our partners to help bring people back into the community.
Do you feel like there are any gaps that could be filled in the work that you all are doing? Do you feel like when you're looking for resources, there's one resource that you could really use that's not there? And what would it be if it exists?
Well, one of
But besides needing more help, period. But do you feel like there's a gap that we need to fill and can be filled?
One of the gaps that I would like to see filled would be doing more on the mental health side. Our State Department of Health deals with substance abuse, but we don't really deal with really hardcore mental health issues. It would be great if we could have a little bit more coordination so that when we have individuals who are seriously bipolar, that we have resources for them. Because, in the state of Maryland is a very interesting system. You have to have insurance. So either we have to get people on Maryland insurance, or we have to deal with whatever insurance they have. And sometimes that insurance doesn't provide the type of resources that person really needs. So I'm not quite sure how to solve the problem, but I know the problem.
Wow, that was a aha moment for me. That's crazy. Like I would imagine you saying it the way that you said it, that in order to get these folks help, we have to have them insured. How in the world? That's just, Michelle Hare, I want to bring you into this conversation. Just as a working person, I know how hard it is to get and keep and maintain health insurance. I can't imagine trying to deal with folks who have a difficult time making decisions to get and maintain and have these kinds of things in place. And I'm sure that there are issues of getting those resources to them when they need them. Michelle Hare, what would you say it has been, I want to change the conversation from what is lacking to what has been the biggest gain? What has helped in the work that you're doing to provide therapeutic services and to get folks who need help? What is the state put in place, the county put in place? What has anyone put in place that has made your job easier?
So I would say they're allowing us to, for instance, we're an outpatient mental health clinic, and they are allowing us to do more services in-house. So we, for instance, we offer individual therapy, we offer psychiatric rehabilitation, which is, for lack of better terms, therapeutic mentoring, which goes along with the individual therapy. So if a person is in therapy, they have their own individual caseworker for what they're called PRP coordinators that actually work with them on whatever issues that they're dealing with in therapy. And we also offer medication management. So while it's great to have all three services in-house, I think that has been very helpful. However, we lead to the other issue of the insured part. So the state kind of makes it a little difficult because they want it to be a rush situation, and it's not. They want people to be healed within 6 months to a year, and they want to stop all the services. So I think while it's great that all of those services have been able to, we could put it all under one house where everybody can communicate, but within a year, they kind of want to push them off, and that's not realistic.
Wow, that sounds like a job for one of our delegates to try and conquer that issue. Tyrese McAllister, I'd like to bring you in, owner, clinical, and forensic associates, or owner of clinical and forensic associates. Thank you for joining us. So if you did have a magic wand, if there was something that you could say, here's something that we can do tomorrow and have the ability to do it, but we're just not doing it, what would that be?
Actually, it would be to reduce the stigma, and we don't need any money to do that. What we need to do is normalize conversations about mental health and trauma. So people may not have a diagnosis, but they've been through some traumatic events in their life. And as a result, they have behaviors that look like mental illness, or look like things that interrupt their ability to work, interrupt their ability to stabilize in school, or to have a good relationship, because they have unaddressed issues. If we talked about trauma more, and if we dealt with it and dealt with the reality of this is not a person who is angry, this is a person and this is their trauma response, and we had understanding of that, we don't need money to do that. That's the first thing that I would do. I talk about mental health. I have a mental health podcast because we're trying to normalize what that looks like, what taking care of your mental health care looks like. I actually am a CIO trainer for Metropolitan Police Department. And while I am charged to train them on how to work with people in the community, I'm also talking in my 40 hours with them about how they care for themselves, because they don't take care of themselves either. They see a lot, they deal with a lot, they shoulder a lot. And what results is morale issues, right? But it's not a morale issue. You're traumatized, you haven't addressed it, you haven't talked to anybody about it, you haven't used the resources that are available. So while we do have some gaps in resources, absolutely we have gaps in resources, but there are a lot of services that are underutilized, that people are not utilizing because they don't want to have a mental health issue. They would rather smoke marijuana than take medication because there's a stigma on mental illness or not being well. And if we treat mental illness like a health issue, nobody's gonna have the issue if you have diabetes, right? If you take medication because your doctor said you have diabetes, you're not challenging your doctor. It's in the blood work. And so it should be the same thing. If your psychiatrist says you have bipolar, you should be able to do it. I think that the resources, definitely, we need some services. We have some gaps, but there are plenty of services that are underutilized and people don't know what the services are.
Wow. Oh, okay. This is good. I feel like we have gotten to a point now where we can go ahead and start to answer some of these questions that we have.
Can I know that, just speaking, like Ms. McAllister just said, there are a lot of organizations like DXT. We actually started a nonprofit umbrella just to make sure that we're able to help persons who are not uninsured. We wanted to make sure everyone is served and without leaving anyone out. So there are a lot of resources and other nonprofit agencies in the area that I think we just don't know about. So I think we're not connecting those dots as well.
And, mental health care really is a human right, right? People need to be able to have health care, and mental health would be included in that. And people need to have homes. People don't have the Maslow's hierarchy of need. If people don't have their basic needs met, they are going to act out. That is traumatizing, not to feel safe in your community. Right. And so it might not look like a diagnosis of schizophrenia or bipolar, but you are going to have people who are acting out. You're going to have children who are acting out who buried 5 friends before they finish high school. They're going to act out. And we're not really talking about that. And we're not addressing it when it's happening in a way that is healthy and helpful. And parents feel like if children go back and play, which is what children do, that they're okay. And these kids are not okay.
Wow. And we keep saying the resilient, right?
Yeah.
Keep taking more and more and more. So
Yeah.
Thank you, Jade Mathis. Thank you, Dr. Amar Mukhtar. Thank you, Greg Franklin, Michelle Hare, Tyrese McAllister. You got a lot of amens as you were talking. Let's open this up now to some of the questions that we have coming in. There was one person, and panelists, whoever would like to answer it, just jump in and let's try to get through as many of these questions as we can. How do you get an adult help before they hurt themselves or someone else? Who would like to take that one?
I'll jump in with that. Under the current laws, you cannot, unless they are likely to injure themselves or injure others. So if they're not a danger to themselves or other, you can't force treatment. And so we need to maybe look at the laws and say that people are really not well. They're menacing in the community. Maybe not intentionally, but maybe we need to reduce that, because there are parents who have adult children living in their homes that are terrorizing them, but they didn't say they were going to kill them. They didn't say they were going to kill themselves. And so and I do emergency mental health too. As a result, we have to leave them in the home. We cannot force them into treatment. So we really need to look honestly at our limitations as mental health professionals, what we can and cannot do. It breaks my heart to leave a adult person in a home with an elderly person who is, terrorizing them, but they didn't say the right thing. So we can't force them into hospitalization. So we really need to look at, and these laws are throughout the United States, but we really need to look at our laws because they're loose.
As you were talking, I was looking up at my books to see if I could find that book that I have on this topic called 72-Hour Hold, where a mother talks about her daughter's mental health issues and the difficulty of getting her treatment when she was having episodes.
And Tracy, I just want to add one thing. Even if you do a 72-hour hold and a person is forced medicated, when they come out, they're not taking their medication. And so you still have the same problem. And so as an emergency services worker, parents or family members are always angry saying you let them back out. But the law says if they're not going to hurt anybody else and they're not going to hurt somebody, it doesn't matter if they're talking to themselves or they're still psychotic, you have to let them out. And that's what I'm saying. The laws are not conducive to citizens who need to feel safe in their community as well.
You were talking about the words, that they're not saying the right words, and I can't count the number of murder-suicides that we have. Well, actually, I probably can, because I can't forget some of these cases where we have had sons who have killed parents. You go into case search and you see these are people who have had domestic calls after domestic call, but they were in that house that night to kill their mother or grandparent. We have another question here, and this may be a good one for the lieutenant. What can you do to prevent the homeless who are receiving trespassing charges if they're homeless? These charges are preventing them from getting into the shelter. Who would like to take that? And I'm saying that maybe it's the lieutenant, but it may be someone else who can, this may be a good question for Mr. Wilson to answer possibly. I'm sorry, Mr. Williams. Mr. Williams, would you like to take that? How to try to help folks get around these charges for trespassing if they're homeless?
It's a very delicate dance that our officers have to navigate with trespassing charges. Just recently I was deployed to Brandywine, and there were some people living in a tent, and the girl was pregnant. Her boyfriend or significant other had a job, but they just found themselves living in a tent. And the Housing Association called us in an effort to sort of get them out of the way, actually, and kind of criminalize them being there. And in the end, we found out through using a satellite device that the couple was actually 50 yards outside of the property line. And so that only the person who owns the property can move to have the person removed. But then first, a police officer has to inform them of that. And then if they're found there again, then they could be addressed as trespassing. And it's a very delicate dance. You got to balance. I think we should be able to resolve those in a win-win kind of fashion. And when I go out, that's what I try to do. I try to find some solution that's a win to the community that feels they're adversely affected, and also find a solution that's good for that person. And it may not happen the first time, and people can't get frustrated. It might take 4, 5, 6 times deploying out there and trying to negotiate this very delicate agreement between people who don't have any place to go and people who feel uncomfortable because they're there. You know, I just think we've got to be a little more tolerant with people who are experiencing these kind of issues like mental health, and then combine it with homelessness, because we're using our logic to say, why shouldn't they, or why are there? And when you have certain kind of challenges, the logic is not the same. And again, everybody gets frustrated on both sides. So it's a very delicate balance for us. We kind of like playing Solomon out there. And I just want to put a plug in for the cops officers of Prince George's County, who usually will call us and wait till we get there before we get into this negotiation process, because it is a negotiation process. And trespassing, we don't want a person to have that on their criminal record, because if you live in some states and some areas, that very trespassing, multiple trespassing charges could affect their ability to get housing once they get stabilized and move forward.
Okay. We have a question here about NAMI, which is an organization I, as a reporter, depend on a lot to help me through some complicated stories. Someone asking, could Prince George's County do a better job of partnering with NAMI and to have them come in to do more work within the community? Anyone have any thoughts on that, and national organizations partnering more with the county?
So this is Jade. Oh, go ahead.
Oh, thank you so much, Jade. So one of the things I wanted to say is that I do think that it's great to have national organizations that support the work that we're trying to do. But what's most important to me are the folks who are on the ground here, because they know the community. They have an investment in this community because they live here. And so the nonprofits that you see with us today, for the most part, they are Prince Georgians. And I think it is really important to have culturally competent responses to the crisis in our community. So I think that national organizations can definitely help us look at models. I think one of the other things they could help us do is to identify money. Whether it's federal government or private foundation grants and other financial resources that we can tap into. I think that's really important. But I tell you, the work that is being done on the ground with the organizations you see here, bar none, they are the best organizations to serve our communities. It's just that we need to make sure that they are, paid well, and that they're given the resources that they need. I did want to just mention one thing about those who, have trespassing charges. While they may be charged, oftentimes when they come to our office, when we evaluate the total person, because we're not just looking at the offense, we're looking at the person too. We don't necessarily move forward on those charges. Oftentimes we'll put them on the stat docket and we'll say, okay, well, we'll stat this with the condition of, you go get treatment, or that you don't go back to this area again, or that, there's some other condition that we will put on, that stat, that decision for us not to prosecute at that time. But we are in the process of developing a homeless diversion program. But what has been stopping us from being able to fully move forward in that direction is the resources. Because if you tell someone you can't be here, well, where are they going to be if they don't have a job, if they don't have resources, if they don't have housing? So, we cannot punish someone for not being able to afford housing. And so we have to do a better job of providing these individuals on this in this forum and those like them with the resources they need in order to build, housing for our homeless populations. And a lot of them aren't what you think. People think, oh, these are people who are just doing drugs, and which is not, for me, I'm looking at it as drugs is a way to medicate a lot of these folks, but a lot of them have very interesting circumstances that led them to be homeless. And unless you take the time to get to know an individual, you don't understand how to help them. So we do need to have a homeless diversion program where we have partners like the ones on this Zoom session who can actually provide more resources than what they're providing right now. And we have to invest as a government in them so that they can invest in our community.
I think, Tracy, allow me. She said something very important. In most of the trespassing things that I deploy on, those homeless individuals who are experiencing mental challenges, it's their own neighborhood. They tend to go back to the areas that they're familiar with. They may have grown up on that street or in that neighborhood. And if they get a trespassing, they're just going back to what they know in a place they feel comfortable and gives them a certain feeling. So we need to know that with trespassing, in most cases, the person has already had a history with that area, and it's like going home to them, and they will continue to go back to that area.
And which brings me to the question I wanted to ask you, Ms. Braveboy, that popped up in the chat. Someone is asking if you could please explain what the homeless diversion program would look like. When you say homeless diversion program, what does that mean?
So if someone is charged, let's say with trespassing or fourth-degree burglary, which is breaking into an unoccupied place, typically they do that to go to sleep sometimes, things like that. So for those individuals, instead of them going through the process of being prosecuted by our office, we would divert them to one of our care providers, many of whom you see here, to do an evaluation on what their needs are. And then, as part of their diversion, if they agree to get the services and help that they need through our partnering agencies, then we will not move forward to prosecute their cases, because oftentimes these are not cases that have victims. I mean, the victims, yes, are people who may feel like they don't want to walk past someone who's homeless, or maybe that homeless person is hanging out in front of a store that they own, and so they're, they feel like the homeless person is preventing potential customers from coming to their store, and we understand that. We understand that, but the reality is that the homeless person is still going to be homeless. So now they're just going to be homeless with a record, and that doesn't help anyone really. And so the diversion would provide an opportunity for them to meet with individuals like the people here that can provide them real services. And if they take advantage of those services, then we would not move forward with the prosecution. We've done that for our commercial sex workers, and it's worked out really well. We have 3 diversion partners for individuals who get charged with commercial sex work, and we could do something very similar. But again, the resources are what we need so that it can be effective.
Well, thank you. Thank you.
Ms. Wilkins, if I could just piggyback on that from a medical clinical side, and what we see often with the homeless population is, unfortunately, it gets circulated and people start to understand ways to get resources when they don't have resources. So we talked about saying the right words. I'm going to hurt myself or hurt somebody else. And what you end up having sometimes is homeless people coming to the emergency room and saying the right words in order to get shelter, on a cold night or whatever it may be. And that puts the clinical staff in a very difficult situation, right? Because you have 1 or 2 beds open, you have someone saying the right words, and it's pretty obvious or clear that they're seeking shelter, and you've got somebody else that may be not saying the right words, which you really feel might need the help or require that bed. and then you're put in a challenging position medical legally. I think the danger of what that over time it might build is this desensitization to the homeless population, right? So if you get a homeless person, you're automatically assuming they're just here for shelter. In the same way, somebody with an opiate dependence, you might, dismiss a little bit their pain complaint because you're thinking that they just want opiates, right? So that's the challenge that we've had with the opiate crisis, and I think you're seeing similar challenges in the emergency room with the homeless population coming to seek mental health care.
All right, we have a question on a different topic. How can we start the conversation? Someone in the chat saying, how can we start this conversation in elementary schools? My son was diagnosed with ADHD at age 7. I was a young mother and did not understand mental health and did not make him take his medication because of the stigma. How do we begin to have healthy conversations about these kinds of issues for parents and folks who just don't understand? Who would like to take that?
I can start off talking about that.
Okay,
and it comes partly back to education. It's a huge piece of this that is sorely lacking for all of our teaching population, our law enforcement officers, and teaching about the effects of trauma, substance use, and all of this. Because in a lot of ways, all of this is tied together. Coming back to that issue of how do you stop an adult, or frankly, for that matter, I'm going to add in a child from hurting themselves before they do. And I want to come back to this piece of saying the right words as well, because it doesn't have to be a set of words. We can completely address this by behaviors. I've worked closely with Mr. Williams' team with some homeless individuals as well, who they're essentially way underdressed throughout winter. And that's one of the things in Maryland that we really need to adjust is how we approach homelessness during winter, because in DC, you can FD12 or involuntary hospitalize somebody in DC just because of the cold. We can't do that in Maryland because of the way the law is currently structured. But we don't need to see words saying, I'm going to hurt somebody, I'm going to hurt them, anything like that. We can basically go off of their behaviors. Still is a case-by-case evaluation, but one of the hardest things we do as a crisis program is going into somebody's home and evaluating when a child needs to go to the hospital versus when they can be stabilized in the community. But again, Santi is actually trying to hire right now for a school intervention specialist, where we can partner with Prince George's County Schools to go into the school and support children in that environment. But it doesn't take the place of meeting the children in their homes, working with them and their families, because they all have needs that aren't getting met. And the pandemic has completely exacerbated all of that, made it worse because the children are isolated in their homes. They're not getting the supports with their community, their friends, their loved ones, the supports of the schools, the break that sometimes provides for the kids who are dealing with these traumatic situations at home. And I think it was Ms. Gale who had brought up the issue of trauma. There needs to be a lot more trauma education and normalizing of that as well, because all of this stuff happens and everybody refuses to talk about it. I think that I saw somewhere in the questions about medications, and sometimes medications do have some negative side effects, but educating the parents in particular that just because one medication didn't work doesn't mean all medications are bad, and having that conversation over and over again to get the children the support they need, the parents the support they need, and having that respite care that just frankly, that's probably one of the single biggest underutilized things in our county is there's not a lot of supports for youth. So
I want to jump in there and say, I'm sorry. I wanted to jump in and also say that we need to look at Kaiser's study of the ACEs, adverse childhood experiences. Many children are being diagnosed with ADHD because they can't sit still in school. And what's happening is we're not looking inside the homes, right? So if a child has a parent that has 2 jobs and the parent is not home with the child at night and the child has stayed up all night playing their game, right? Because they're not adequately supervised because the parent doesn't have that much support, then that child could be looked at ADHD. Are children eating breakfast? Do children have lunch money? And we have children who families might not be on the poverty line and get a free lunch, but their family still can't afford to get them a lunch, right? So there are a lot of other things, and those things are traumatic. What is happening in the community? If our children hearing gunshots all night, is anybody talking to the children about what other traumatic events before or alongside of a diagnosis. I'm not saying that the diagnosis is incorrect, but maybe it's not a full diagnosis because we only looking at the child's behavior in the classroom and not what else is going on at home. And then is the school equipped to help with resources? One of my friends teaches in Prince George's County School, and she told me that she is not allowed to give a hungry child lunch. And I get how that could be a legal issue. But she's charged to teach a hungry child. And not be able to support the child with her own money. And I get why she can't do that. I get the ramifications of that, but yet and still we have a hungry child that's trying to learn, and you can't learn when you're hungry. So just some of the things that we have to, I get the laws, but we have to make provisions for the issue, not just protecting ourselves, right? Like we have to figure out other ways to protect this child, protect the teacher, feed the child, and let the child's basic needs get met. When children 0 to 7, these ACEs have a huge impact. When I do ACEs for my adults, they have 3 and 4, at least 3 and 4. Some of them have more. And so if these things have been addressed in their childhood, 0 to 17, this might not be an adult that needs so much repair at this stage of the game. So we're not really looking at it. ACEs is Adverse Childhood Experiences. It's a 10-question survey that Kaiser came up with a number of years ago. And if you have 2 or more, you're likely to have some dysfunction, dysregulation, exposure to or opportunities for mental illness, predisposed to other stuff and trauma. And so we have to really look at that. Many of my clients have at least 2 to 3, some have 4, some have 6. Right. And so it's almost like they don't really have a chance to grow up to be a healthy, normal adult because some of the stuff is not really being addressed at when it needs to be addressed. Right. Like you address it at 40 and we just try to fix some of the stuff, but it's a lot of times damage has been done in relationships and how you related to your teacher in school or how you were dealt with in school, or you may have lost 2 or 3 jobs before you finally say, maybe I need some help. Right. And then we're picking up pieces versus like, shoring things up before these bad things happen.
One of the things that I would like to throw out and what is striking me as I'm hearing as I'm reading the comments and I'm listening to what people are saying, I think that part of what's happened here is that our communities have changed faster than we have. I mean, in how we address and specifically what Prince George's County looks like now versus what Prince George's County looked like 20 years ago. And even that now we are more of a migrant kind of community, right? Because there was a time in Prince George's County where everyone knew their neighbors. And not a long time ago, but folks kind of settled in and then stayed. So you could keep an eye on that kid who had a problem. You could, some folks in the same communities went to the same churches. But now we're all over the place. Our kids are going to different schools. We're not all necessarily going to the church that's closest to where we live. We're not necessarily going to the school that's closest where we live. We are so separated and folks are moving in and out that it's hard for the community to keep an eye and tell the officer or tell whoever this is what's going on in our communities. I mean, would you all agree with that that's part of what's happened here, that it's become such a transient community? It's harder for resources to keep up with what's happening in the county? And if that's the case, then who needs to come in and kind of address these issues? Who would like to take that?
I'll take it. Transient, the neighborhoods are transient, but what's happening really is that we don't have the sense of community and people are afraid to correct or support other people's children. Years ago,
you don't know them and you don't know their parents.
And even if you if you know that, so as a child growing up, and I grew up in New Jersey, in Newark, New Jersey, and if an adult corrected me, I didn't have to know him, and neither did my mother. But if they found out where I live and came and told on me, there was going to be something to pay. And today you don't have that. Even when teachers are sharing information about a child's behavior, they are afraid for their lives sometimes. They are concerned, or they are not met with the kindness or receptivity that they're calling as a teacher to talk about their children's behavior. And it is, I mean, we have to really be honest about like what's happening in our schools and in our communities. And I really don't know how to address something like that. But you're absolutely right. The neighborhoods have changed, but people have changed too. And again, that's not just Prince George's County, that's all over. That teachers are afraid to talk to parents. Like I don't have any understanding of that. People are concerned about correcting children who are misbehaving in the community. And because some of these children are violent. And I mean, and because we're not addressing other issues at a younger age, we're not addressing access to guns and weapons, and they're, you know, they're not intimidated by using them.
Wow. All right. Well, thank you, everyone. This has been just an enlightening conversation. And for the folks in the chat, I mean, they are just really thankful for all of you taking the time that you have taken to answer these very complicated questions. I think it's so good that you all have helped to give us some direction. And at least in just the beginning in this small conversation that we're having about where we can go and what resources we have. Thank you, each and every one of you, for your time, for your dedication to this community, and for the work that you are doing to try and improve the place that we live and to make it better. And so thank you. Thank you. Just really appreciate it. And Jade, I have a question for you. Are we going to see you on that TV show? Are you?
Yeah.
Off
You will
topic.
see. Yes,
you
will
will
see.
your dad's TV show. This is Judge
We'll
Mathis's
see.
daughter. They got a show
Yep.
coming out. All right.
Juneteenth on Father's Day, if you'll see me on Mathis Family Matters on ETV. And I'll be talking more about the work that I'm doing in mental health as well. So please check us out. If you love my dad, Judge Mathis, you'll love my family show.
This is fantastic because I love that you're able to take this platform nationally and have this conversation. I think that part of what we can take away from all of this, everybody, is that we've been given some marching orders, and I hope that everybody saw that, to start to ask for these conversations to happen in spaces that are safe places. So talk to your pastors about it if you're in church. Talk to your PTSA, because I know all of the folks on here who have kids in the Prince George's County school system are a part of their parent-teacher associations and are active. And so have conversations there. Folks who are in, somebody's saying community college, have the conversations there. Start in these places to have these conversations and figure out what are the resources and who are the folks who can help to support. And in the meantime, we have all of these other folks who need backup. So hold your delegates accountable, your county council members accountable, your local mayors, and the rest of these folks. Make sure that the resources that you need are being brought your way. And always be sure to watch NBC4 Washington at 4 a.m., 5 a.m., 6 a.m., and at 11 a.m., and at 4 p.m., 5 p.m., and 6 p.m., and 11 p.m. We have more news than any other news station, and is always an honor to join the community and talk about things that matter. We're the only news station with the Prince George's County Bureau. I am a Prince George's County native who is wholly dedicated to making sure that we address the issues and shine a light on what's happening in our community. Thank you, everybody, for being here today. And I would now like to bring in Ms. Karen Tolles, who is the CAU Director for the Prince George's County State's Attorney's Office. Ms. Tolles.
Before Karen Toll speaks, if I can, I believe that Ms. Wright, who has been patiently waiting for just one question to be answered, which is where do we go from here? And I think that's a great question. I have an answer for you. As I mentioned earlier, we are very interested and focused on creating a homeless diversion program, but we need all of our partners here, as well as our community stakeholders, to be a part of that larger discussion. So what I'm going to task my chief of staff, who is overseeing that with, is to invite you all to a meeting for those of you who are interested to discuss the implementation of such a program, the resources that we have, and the resources that we need in order to make it effective. So I think it would be wonderful for so many of you who are on here who have an opinion or thought or some specific, training or just educational, who went to school to assist people, whether it's a teacher, a social worker, whatever you bring to the table, we want. So please, we will send out very shortly in the next couple of weeks a link to join us for a meeting to discuss the homeless diversion program. So for those of you who registered for this session who are here, you will be invited. I think we have everyone's contact information. If you do want to put your contact information in the chat, you can do that. Also, I noticed that my Chief of Staff, Judy Danzo, just put her email address in the chat. So please reach out to her. But whoever's invited here, I think we have your email address. And so if you would like to join us, you'll get an invitation to join us to talk about implementing this new, exciting, and much needed diversion program for our homeless population. So thank you all very much. And I'll now turn it over to Ms. Karen Tolles, Director of Community Affairs.
Madam State's Attorney, and thank you so much, Tracy Wilkins, for having such a powerful discussion of this month's CIC with the Office of the State's Attorney. And so as we move into the month of June, if you thought this was phenomenal, just stay tuned for upcoming events. So we would love for you to mark your calendars. Thank you so much. I think communications is going to pull that up of events that we have coming up the next month in June for our community in the courthouse. While that's coming up, will be our second year of having a discussion around LGBT issues and the criminal justice system for the month of June. We also are having a multicultural festival next month.
Just trying to pull it up. Keep going, Karen. Doesn't want to advance.
You're muted, Karen.
I'm sorry. Thank you, Tracy. Thank you. I said I was trying to remember the dates in my head, but the Multicultural Festival will be a fantastic way to celebrate the diversity of our county and the partnership they have with the State's Attorney's Office. And Multicultural Commission was put together by State's Attorney Brave Boy. And so it will be a celebration of the various cultures that we have here in Prince George's County. Next month is Gun Violence Awareness Month. In the beginning, you heard the State's Attorney talk about her work with ghost guns, and next month we'll take into a new law regarding ghost guns. So next month, okay, there you go. Get back on schedule. Save the date for the Multicultural Festival is June 11th, and that's from 12 to 6 p.m. at the Showplace Arena, and that's going to be great. We can go to the next one, please. Thank you so much. The second, I think this is the third or fourth year of this event. I believe it's the fourth year of the Men and Youth Leaders event, and this will be at Country Club of Woodmore on June 23rd. And so this is a powerful discussion that we've had athletes in the past talk about ways to help our youth in Prince George's County. So it's the men helping the youth, and also will be golfing and a great discussion. Next event, please. And I mentioned this before, the June 24th through 26th, we will be having a number of Pride events that the State's Attorney will participate in. And that fourth Tuesday in June will be our community courthouse in conversation with our LGBTQ community. And this event right here, oh, okay. And finally, okay, we June is Pride Month, so we're going to be busy recognizing individuals in the LGBT community. And the next slide for Our Streets, Our Future, June 28th, And Easy Street has been an ongoing partner with the state's attorney's office. June is Gun Awareness Month, Gun Violence Awareness Month. As I mentioned, a lot of laws are changing around the state. And so that will be 5:30 to 7:30 at our Eastover Shopping Center. And so as you can see, we have a number of wonderful events coming up in June. If you are not already signed up, please subscribe to the listserv, pgsao.org, to stay up to date on the events that we are having. Thank you so much.
And Karen, just quickly, I wanted to mention, I'm Denise Douglas, by the way, part of the comms team. If you did not get your question addressed during the wonderful discussion, we have taken note of it and we will respond to you. So we don't want you to think we didn't get to you. We will get to you even after this discussion. Okay, State's Attorney Braveboy, any closing remarks? Or I think you did say what's coming up next. Anything else?
No, just that we want you to come to all of our events. We appreciate the input of everyone tonight. I think this was such a powerful discussion, and I'm so happy that so many of you in the community had something to say about it. And that's very important, because that means that we're really tapping in on an issue that's really important for members of our community. So thank you for joining us, and we look forward to seeing you at upcoming events.
Absolutely. Thank you. And stay connected with us. You see our website page there and all our social media. You can connect with us on either way.
Thank you so much for joining us for the May edition of Community in the Courthouse. For more information on our PGSAO events, visit our website at www.pgsao.org. See you in June.